So this is a sample question I made myself. The first thing I always do is read the last sentence in the question. The process creating the signs and symptoms seen in this man is due to antibodies directed towards which channel? At this point, I refrain from looking at the answer choices as it sort of differs me from using the multi-step process that's needed to get from the question to the answer, and it doesn't allow me to think of a more global picture as I start reading the question stem. So keeping the final question in mind and what they're asking, an autoimmune disease, we can start reading the question stem. You can pause here if you'd like and read the entire question yourself. I'm just going to go through and point out some important details. The first being always the demographic of the patient. They will always give you the age and the gender of the patient, so it's important to keep that in mind. And off the bat, this demographic doesn't generally fit with autoimmune diseases. So his initial complaint was weakness when rising from a chair. Physical exam reveals slight drooping of eyelids and some trouble speaking. So automatically with this sentence here, if you weren't aware of the demographic of the patient, you could possibly think about the myasthenia gravis as being one of the differential diagnoses here. So continuing, he has a smoking history, 25 years, half a pack. Also, along with auscultation findings with diminished breath sounds unilaterally on the fifth intercostal space, but is otherwise normal. His muscle weakness seems to get temporarily better after exertion. So this is an important sentence. If you were thinking about myasthenia gravis at the beginning, and generally the signs of myasthenia gravis gets worse at the end of the day. So this sentence kind of deters you from myasthenia gravis. And thinking about the global picture, reading the last question again, everything that fits here with the demographic of the patient, with his smoking history, and with the auscultation findings, we can start thinking about lung pathology and lung cancer, more specifically small cell carcinoma that's related to his smoking history. And of course, the paraneoplastic syndrome of Lambert-Eaton myasthenic syndrome is related to his initial physical findings and complaints of weakness when rising from a chair, so muscle weakness. So once we're happy with the diagnosis and everything fits, you start thinking about Lambert-Eaton syndrome. You start to see if everything fits. So you go back to the demographic, see if it fits the smoking history, and also the other clinical findings. And the question is doesn't stop there. It goes one step further and asks about the pathophysiology of Lambert-Eaton. So we know that the antibodies are directed toward the presynaptic calcium channels. In this case, sodium would be the differential if we were thinking about myasthenia gravis. However, we know that's not the case, and the others are just distractors.